Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Just about everybody realizes that smoking is not a great choice for their health, but man, quitting can be so challenging and difficult. There are ways to help, and there are reasons why you should be doing it. So let's talk with Nurse Practitioner Linda Salem about that today. We're excited that you're here to share these tips. Let's talk about why it's important. First off, that people quit smoking, the detriment to your health.
Well, the longer you smoke, the worse the problems can occur with it. But when you do smoke, the little cilia or the hair-like projections that are lining in your lungs that help to get all of the accumulation of dirt and gunk and stuff that we breathe in becomes somewhat paralyzed. So you get the tar and the nicotine and all that stuff gets accumulated in there. Then once you quit smoking, those hair-like projections start regenerating and reusing, and then that helps to kind of regenerate. So it's never too late to quit.
Never too late to quit. I love that emphasis. And of course, smoking can lead to very serious health concerns.
Right. There's the lung cancer. There is COPD or emphysema. There's also increased risk of bladder cancers that we see, heart disease, hypertension, cholesterol, all of those. There's many issues.
That I hope smoking helps amp up all those conditions and make them serious.
Yes.
Let's talk about the long-term and short-term health benefits of quitting.
For one thing, there's going to be a lot of money saving that they're going to get. That's one thing I always tell my patients is that just think about how much money that you are saving with those cigarettes and then reward yourself with maybe something that you want to do or whatever, which with all the money that you normally would have spent with those cigarettes. There's that. There's also just feeling better, breathing better, having a better appetite, which could be good or bad, your stamina, skin, healing better. You know, we always want everyone, of course, to quit smoking before they have any surgery. We do find that, you know, with the nicotine and all the other things, that you're not getting the oxygen to your cells, and so you don't have healing as well. So that's some of the short-term and long-term effects. When you do quit smoking, it does decrease your risk of cancer. When we do the health screenings, one of the risks we look at is how long have you smoked and when did you quit. And if you have quit longer than 15 years, we don't even recommend that you have the health screen of the low-dose CT scan. So it's never too late.
You mentioned too damage to your lungs. Can you get lung capacity back? Do your lungs ever heal themselves after?
It can get a little bit better. Depends on how long it has been and how old you are when you quit. I mean, if you have severe end-stage COPD, you may not get some of that lung function back. But I do have a lot of patients who have been long-time smokers, and they're already noticing that they're not using their inhalers as often. They have more stamina. They can get up the steps easier, more energy. Food tastes better. They're just happier. Yeah, actually happier.
So let's talk about some tools that can help in the journey to quit. What kind of things are out there?
There's yourself. You know, it's between a habit and also an addiction. So with the habit part, you know, it can take sometimes at least 90 days to establish a habit. So it takes at least 90 days to de-establish that habit. So be patient with yourself. But yourself, there's also, some people do patches. There's lozenges, there's gum, that has the nicotine in it. So what that does is supplies your body with the nicotine of the addiction so that you can be working on the habit. What do I do with my hands? What do I do with my mouth? What do I do when I eat certain foods or I'm with certain people? There are some medications, there's some antidepressants that we have found that help people not want to smoke as much. They work on some. There was one that was out for a while. We don't use it quite as often that people would quit smoking with, but we did find that it had a little bit of some depression with it, so we don't use it quite as much as we did.
But talk with your provider. There are ways to help make it not so hard.
Yes, yes. You know, you can do it individually. There's group therapies. Some people worry about if they want to pay for patches or whatever. Many your insurance companies, if you do like a Why Not Quit hotline, they will help you to pay for that. And if you think about it, it's about the same cost as what you're paying for your cigarettes, and you're not going to be buying cigarettes.
And you're getting the health benefits.
And you're getting the health benefits, exactly.
Right. Some great things to think about as people try to quit. Linda, we so appreciate you being here. Thanks so much.
Thank you.
Thanks for checking in on Monday Health Minutes.